Hi, I'm Dr. Ron Miller with Pursuit Physiotherapy, and today we're going to go over the 4 different types of low back pain. If you're suffering with low back pain, you never want to go to a specialist, walk in with low back pain, and walk out saying you have low back pain and just go take some meds. It's important to understand is that there's different types of lower back pain. Lower back pain is just kind of a summary or a cluster of the effects. And the key to get results or get the end result or to be pain-free is to solve the root cause. So what I like to do is kind of categorize, there's different types of lower back pain, and there's 4 main types, okay? Going into acute versus chronic, that's just a timeline. Like acute lower back pain, will be in the first 3 weeks, maybe 4 weeks, and then you have subacute, maybe a month or 2 months, and anything beyond 3 months is more chronic, but that doesn't really tell me anything of how to treat you. So the first type of back pain, which is very common, is a disc or a discogenic, okay? A lot of times people will say sitting, bending down, driving, and lifting things cause their back pain, and they say standing and walking makes it better. Normally, it may be a bulging disc or it's some sort of discogenic pathology. The second type would be the worst version of that, which is a full-blown herniated disc. Now, not all herniated discs cause this, but a lot of times when someone has sciatica, more than likely if they fall in that same pattern, sitting, bending forward, lifting things, and driving all cause their pain. If the herniation is big enough, it'll actually pinch on a nerve root, and thus you get sciatica. Thus, it's shooting down the back of your leg and going down to your calf and maybe even to your foot. So sciatica is the number 2 type of back pain that is commonly, and I'll categorize a herniated disc along with that. So the first one was just like a discogenic origin. Second is a herniated disc. The third one, I'm going to label this as compression. And there's a lot of different diagnoses that could fall into this pattern. It can be on both sides of your back. It can be on one side of your back. But the compression type of back pain, you could have a spondy or a spondylolisthesis. You can have arthritis, DDD, which is degenerative disc disease. You can have a facet problem. You can have, I already said spondy. You can have any type of compression type of back pain. And again, it could be on both sides, it could be on one side. This type of back pain will kind of present like standing, walking when a woman wears heels, and any extension-based exercise makes things worse, and sitting and bending forward makes it better. Stenosis would also fall into this category also. So this is my third topic, or my third type of back pain. It's just more compression. It can be on both sides, it can be on one side, and again, your diagnoses after an x-ray or an MRI will show signs of DDD, arthritis, stenosis, facet problems, hypertrophy, stenosis, and also like a spondy. I'll just say spondy, so you don't have to look up spondylolisthesis and what does that look like. So that's the third type. The fourth type is an SI joint pathology. Now, this is not really low back, this is more pelvis, but a lot of people just say they have lower back pain, and it turns out to be an SI joint problem. Most SI joint problems, a true SI joint problem, occurs after giving birth and labor. So guys, you're cool with this, you don't have to worry about that one. Or after a significant fall sometimes. Those are true SI joint kind of mechanisms of injury. But every now and then, you can have either like a mobility problem, like tight hips that cause maybe some SI joint dysfunction, causing some SI joint pain, and you could have a hip flexor tightness and other things above and below the SI joint that's adding into this, causing thus some SI joint stuff. So just to go over it again, the first type is more discogenic or a disc problem. Again, sitting, bending forward, lifting is going to cause a lot of your symptoms. Standing and walking makes it better. 2 is going to be a full-blown herniated disc, and you may or may not have sciatica with that. It'll follow the same pattern as the first one. Sitting, bending forward, and lifting things cause your pain, but standing and walking and laying down make it better. The third one's going to be compression. There's a whole bunch of diagnoses that fit into this, but the main finding is standing and walking make it worse. Sitting and bending forward make it better. And then the SI joint one is the fourth type of back pain. And again, this can be either caused postpartum or post-labor, a significant fall or an accident, or you could have some hip mobility issues that's pulling along the SI joint. And the most important thing of this is what type of low back pain do you have? And then once you know that, then you know how to treat it. So everything should be customized and not standardized. So it's not just treating low back pain with a cookie cutter approach across the board. It's what type of back pain do you have? Once you identify it, then you know how to actually treat it. So if you're struggling with low back pain, or if you don't know what type of low back pain you have, I hope this video helped. If you want some more information about how we treat lower back pain, you can visit our website at pursuittherapy.com. If you're ready to get started and ready to get some relief, we would love the opportunity to help you. You can give us a call today at 407-494-8835. I hope you enjoyed the video, and thanks for tuning in.